Hello everyone, my name is Kelly Murillo and I am the Marketing Manager at the Obesity Action Coalition, one of the founding champions of Obesity Care Week. Welcome to Day 6 of Obesity Care Week 2021. Today we're recognizing Childhood Obesity Day. Obesity is a disease at any age, and childhood obesity affects more than 18% of US children and adolescents, which is more than 13 million. Additionally, the current pandemic has resulted in rising childhood obesity rates. We know that childhood obesity is complex and it can be sensitive and a difficult topic to navigate. Today, we wanted to have a meaningful dialogue about childhood obesity. So we thought we'd share perspectives from both a childhood obesity expert as well as a parent that has navigated this topic. We're going to play a one-on-one interview between Nikki Massey, OAC National Board Member and volunteer, also a parent affected by obesity who has navigated childhood obesity in her family. We're also going to have Dr. Fatima Cody Stanford, obesity medicine physician at Massachusetts General Hospital and instructor at Harvard Medical School.
Okay, so it is Obesity Care Week, and I'm really excited about the conversation that we're going to have today. We are going to talk about childhood obesity. This is a topic that has been trending in the news lately, especially during the time of COVID-19, and I am very honored to be joined by Dr. Fatima Cody Stanford. And first of all, how are you today? Thank you for joining us.
Well, it is my absolute pleasure to be with you, Nikki. It's always great to be with you. So I'm excited.
Well, let's just dive right on into this topic. There's a lot to talk about. So we've talked before, and you know that I personally have struggled with obesity my entire life from the time I was born. I have two daughters. They have struggled with it as well. From your perspective as a doctor, do you find that childhood obesity is more of a family affair? Do we tend to see it run in families like mine?
Absolutely, Nikki. I think that you bring up an important point, and you have your lived experience to really support this. But I think the one key thing I always like for people to know is that weight is more heritable than height. And so I'm going to say that once more so it can really just marinate through the brain cells. Weight is more heritable than height. So when we talk about parents that have had a history of obesity and going into delivering offspring, i.e. your two daughters, the likelihood that children will also have obesity, if their parents have had obesity, is somewhere in the order of 50 to 85% likelihood. So that's very high. That's very potent. And it's interesting as physicians, as we're learning and we're training in pediatrics and obesity medicine, we learn a lot about calculating mid-parental height, right? So we see tall parents and we're like, oh, well, they have tall parents. They're going to be tall. Or if their parents are shorter, right? Oh, they'll probably be pretty short, right? We think that way in terms of height, but we don't think that way in terms of weight, but actually it's a much stronger correlation between the two. And this is not to blame parents that are listening. This is just to know that, okay, look, this is something that is highly heritable. If indeed this is the case, there may be some struggles in my family. And how do I approach this from the family perspective? Because what we do know, Nikki, is that family care for obesity is much better than individual care for targeted at the child. So let's say you bring in your 4-year-old and we just focus on the 4-year-old. I'm just using that as an example, as opposed to focusing on the entire family and the spectrum and the struggles that have often happened. So I love, Nikki, my favorite thing is really caring for families with obesity.
And I think that's so important.
Yeah, all the families that I take care of, I think they will tell you, I take care of some where I'm taking care of 3 generations, Nikki, where I'm taking care of the children, the parents, and the grandparents. And I have several families that fit in that domain. And of course, what I do in terms of supporting their care and treatment for obesity may differ from person to person, but the messaging, the support is all within that same realm. So it actually brings me significant joy to do that work.
Well, speaking of how we care for obesity, I know that as my girls were coming up and I would take them to the doctor, they had this very sweet pediatrician. He had been the pediatrician for them as well as their dad and, on up. Like he was just like the family pediatrician. Yeah. And whenever we would discuss their weight, he would tell this story about how he lost a bunch of weight when he was younger, but he did it just by not eating half the food on his plate. And so that was was sort of the thread of the advice that he gave us, is like to sort of move less and eat more. But we know that that's not the whole story. So like, what would you say to a parent who comes to you and says, my child is really, really struggling with their weight? What do I do?
Well, Nikki, I like to take a full approach to see, before I make this assessment that someone has, has poor diet quality, or they have excess, caloric intake from food or an activity. I have to listen to the story. I can't make that projection. I think that's part of the weight bias that doctors often exhibit towards patients. And it's interesting because just last night I had a old friend that had struggled with obesity reach out to me. She's been in Atlanta, and her daughter also is struggling with obesity. And she was very frustrated with the fact that every single doctor they see tells her exactly what this pediatrician said. They're feeding her very healthy food. She's very active. She's involved in several sports, even in the middle of the pandemic. And, she's like, look, I want to hear something else. So I was able to point her in the direction of someone that I knew knows this complex multifactorial, issue that is obesity. So for some people, it's more than just diet quality. It's more than just physical activity. It's just that genetic milieu, and they may need more, strategies to approach it, maybe medication, maybe surgery, depending upon what the person is at, or what their issues or struggles are, to really approach it. One thing I also like to do on my kids that come in that have severe obesity is I can test to see if there's some genetic component that's a strong genetic marker. And thankfully, there's a company that I'm able to send that information to, where basically the kid gets a little kit at their home. They just spit into the kit, and then we're able to run for different variants for obesity. Sometimes, even if we don't have a specific treatment, Nikki, for that variant of obesity, just hearing that, oh my gosh, it's not just my fault because you're seeing this marker, it can be reassuring, right? It can be reassuring. And so I never know what's going to come back, right? I don't have a magic wand to wave over children's heads and say, this is the cause. But I can do a deep dive and listen, and then match all of the medical pieces of the puzzle up with the family history and, this genetic component. I think that these are things that I really try to do with every single patient before making assumptions about, you did something wrong, you should be doing this better. I think that type of pejorative language is only going to harm people. And I think the key thing that if pediatricians are listening to me, I don't think you realize the power that you have.
Definitely.
When you were, as a pediatrician, you're telling, a child or parents, you're setting up that entire dynamic. That child goes on to become an adult, and what happened to them, what they experience in the healthcare setting as a kid, sets up their entire dynamic for what they are going to express and or expect from their treatment when they become adults. So if it's a bad experience early in life, you can imagine they're going to avoid care when they often need care, especially if they've struggled with obesity.
And with parents, if you want us parents to be your partners in keeping the child healthy, sometimes I think, I don't ever think the pediatrician had like ill will or anything like that, but I did sometimes feel judged and sort of shy to come with these issues and ask for help. So, if we want to take sort of a teamwork approach, and especially if we want to take sort of a family approach and say, hey, let's look at the whole family and see what's going on here. It's good to sort of learn about the individual people first. So I love that. I love
Absolutely. That. It's so important. So important.
Yeah.
I always like to think about, obviously stories pop into my head. And I had a patient that I just saw yesterday, a 15-year-old boy, his BMI or body mass index is about 55 or so, coming in for an initial visit. So it was being sent over by his pediatrician. I was doing this video, or it was a video visit. So it was via telemedicine. The young boy did not want to come on camera. His mom came on camera. Eventually he came on camera. Unfortunately, he has a new diagnosis of diabetes. He has, quite a few things. And when I mentioned, for example, considerations that I thought were best to care for his obesity, particularly surgical interventions, which the American Academy of Pediatrics, for example, has come out in strong support of early intervention for pediatric patients. He was like completely, pushed aside. Now, his mom was like, as long as you live under my roof, you're going to do what I say. But then I also recognized the mom struggled. And I said, Mom, who's caring for you? And then she was like, oh, I never thought about that. So now I'm going to be caring for her too. So I said, maybe you setting the example for him will lead him to consider something differently. And often I see this is the case where the parent decides to proceed with maybe a therapy that, we're considering for the child. And it's only at that moment that the child's like, well, mom did it, or dad did it, or both mom and dad did X,
Maybe
Y.
I can give it a try too.
Exactly. And so I think that, for this young gentleman who saw me for the first time, it's going to be his mom's attention to her own care that will then yield the best results for him.
Oh, that's great. That
Yeah.
was a great example. So
Yeah.
you had mentioned a couple of things that I want to go back to.
Okay.
One of which being the possibility for minors to have surgery as a treatment
Mhm.
for obesity, and then also about some of the things that the American Academy of Pediatrics has said. So, what, from your perspective, does the future of obesity treatment for children look like? What direction are we headed in with that?
Well, I think we're seeing expanded consideration beyond this eat less, move more, right? Which we know is a mantra that has not worked well for either the pediatric or adult population. So I think we're seeing big groups like the American Academy of Pediatrics move forward with really strong considerations of the data, right? The data shows that using things like surgery for those that have severe obesity, most effective treatment for children that have severe obesity. I think we're going to see more coming in the realm of the use of pharmacotherapy. We've just had 2 new drugs, for example, approved within the last 2 months for pediatric obesity. I think we'll see more open up in that spectrum as people begin to recognize that we use medications to treat every other disease process. It might be nice to use it to treat obesity also. And, obviously the behavioral realm has kind of always been there. So I think we'll see this expansion. I think we'll see an expansion that mirrors what we see, for our care for our adult patients. I think it's going to be slow. It's always slower for the pediatric patients, especially surrounding obesity, because there's still so much bias and so little training about this disease in medical schools and residencies and fellowships throughout the world. And so we need to step up that education. And I think that's universally. So how do physicians or nurses or PAs or NPs, how are they educated about this disease? And the problem, Nikki, really lies in the fact that they're educated minimally, if at all, about the disease. They learn about diabetes, they learn about sleep apnea, they learn about heart disease, they learn about all of these things. But if you ask them a simple question about obesity, they revert to whatever they were taught by, let's say someone in their family, or what they learned on some television show, or now social media. And that's problematic because this is a real disease with real pathophysiology, with real treatment strategies that can be effective. So those are my thoughts in terms of that, Nikki.
So, with if you consider the parents, the doctors, everybody who would be involved in helping a child with obesity,
Mhm.
um, I know that one of my fears
Mhm.
had always been, as a parent, has always been that I don't want to give them a thing about eating or a thing about
Mm.
their bodies. How, as a practitioner, do you handle that? And is that a concern that parents bring to you, like, oh, I don't want to give them a
A
eating
complex.
disorder or a complex or something like that?
Well, so, I just treat it for the disease it is. And so when I'm explaining to both the parents or grandparents and the children, I say, look, this is this is a disease. We're treating this just like any other disease. So once we get people to think about it as a disease, as opposed to like a problem I have or issue I have, then you begin to open your perspective. So actually, Nikki, what I have all of my patients do, and they can support me. I wish we had a poll where they could check off a box to see if I do this. I actually have them watch a video that I give on the complexity of obesity prior to their visit. It's more for the parents, especially for the small children, but for my kids that are in their adolescent years, they are going to be able to pick up and understand. Um, the reason why I do that, Nikki, is because I need them to understand how I'm approaching this disease differently than what they've likely experienced in any other interaction. And when they've watched that, because they haven't always watched it when they come into the visit, they're set up in a different way. They know I'm not going to immediately attack them for something because that's not the approach I take. So they learn, wow, I didn't know all of those things. It's not just about calories in and calories out. Oh, wait a minute, you don't mean I have to work out 6 hours tomorrow? Oh, wait a minute, I can eat more than 500 calories. These types of things that they have learned that they should be doing, should be with a big, air quotes. I'm trying to undo that, step by step. By setting them up at the beginning or prior to them meeting me, they know that we're going to approach this from a very different perspective, looking at the complex disease process and looking at all of the factors that may play a role. And I always tell them, Nikki, look, there is often a lot of trial and error in the care for obesity. I might say this was something we should try, and it may not work for you. And then the next thing may not work. And then the next thing, and maybe it's item number 5, door number 5, if we were in a talk show, that works. And it's okay. Everyone's different. I want you to compare yourself to only yourself. Unless you're an identical twin, I don't expect you to respond the same to any therapy. And I see that across families. I mean, I have some families where I'm taking care of 5 family members, and each of them respond so differently to something that I try. But you can't go compare yourself to your sister or to, your cousin or whomever. You have to compare yourself to yourself. And let's work on focusing to make sure you are your best self. So that's kind of how I approach it.
There's also a thing of like people not thinking of obesity as a disease, because like when you think of something like cancer, I myself am a breast cancer survivor, and if my first treatment for breast cancer hadn't worked, I wouldn't have thought of myself as a failure because of it. So it's interesting, we gotta change that mindset.
Yes, absolutely. I think, Nikki, that's extremely important. People think of cancer as a disease, nobody questions it. People think of diabetes disease, nobody questions it. But there's been such a resistance to recognize it. And you have to think it was only in 2013 that the American Medical Association acknowledged obesity for a disease. And there's been a slow uptick in physicians coming to terms with the fact that, wait a minute, I'm caring for a large patient population that I have no idea how to care for. And so doing a better job of seeing more people get certified in obesity medicine, those of us like myself that are actually fellowship trained, really spending time. So that's my thoughts.
And so I just have one more question for you. And I'm going a little bit off script here because this is something that I think could probably be helpful to other practitioners to hear as well as parents. Is, we have sort of a model of care where you take a child to their pediatrician or their primary care doctor. It isn't always easy getting past that person if you feel like you need somebody who specializes in weight management. How does a parent who is really concerned for their child's weight and health get to a practitioner like you? What is the best route to get to someone like you?
So I think the first thing that I would do if I were, kind of starting and had no idea where to go is I would just go to the American Board of Obesity Medicine and find a physician in your area. So what I like about this going to their site is that there's not a paywall, so you don't have to pay and subscribe and submit your email and do all of these things. You can just find a physician by zip code, okay? And you can see what their background is. So if they're pediatrics, you'll see they're pediatrics in obesity medicine. So someone that's taken time to get certified in obesity medicine likely has a higher degree of interest and a higher degree of understanding about the disease than someone that hasn't. So I think that would be the first step that I would do. Just go to the American Board of Obesity Medicine, do a search by zip code, and find who's in your area. Now, you can always speak directly to your pediatrician to see if there's anyone within, let's say your hospital setting or network or private, practice group, whomever. There are often people that are there. And actually, I had someone reach out to me from Michigan earlier this week that was looking for someone, and they have someone like in their hospital that they had no idea. I just did a quick search and I was like, oh, wait a minute, isn't this your same healthcare group? And then I found out they were in the same location, but they just, didn't cross paths. So sometimes there are people close. And then there's sometimes, we may struggle with finding people that are in that area. And so you may need to go to more of what we call a tertiary medical center, the big name schools, Mass General, which is under Harvard, Stanford, all of these different places that have, dedicated care teams for the treatment of obesity. So, but I think the easiest thing to start is the American Board of Obesity Medicine site. There's no paywall. You just find a physician and then it shows you who's certified to care for patients with obesity.
Well, thank you so much. I have enjoyed this conversation. We could probably talk all day.
Absolutely.
But I just want to take a moment to thank you for everything you have done, everything you are doing. I'm excited to hear more from you. A little bird told me that we'll be hearing, the OAC community will be hearing more from you. I don't want to
Birdie was
spoil
right.
anything,
I think the
but
little birdie was right, Nikki. I'm going to go with whomever that little birdie is. Yeah.
I certainly hope that little birdie was telling the truth, because it is always such a pleasure to talk to you. Thank you so much.
Thanks so much, Nikki. You're a delight and just an amazing advocate across the board. So thanks for taking time to interview.
Thank you so much.
There was a great and productive dialogue from both perspectives. Don't forget, the OAC has resources on this topic: Understanding Childhood Obesity brochure, the Kids Corner at the Weight Matters magazine. If you use these resources, we ask you, visit obesityaction.org/donate and make a donation today. We also want to thank our OCW2021 partners: Novo Nordisk, Medtronic, Ethicon, Eli Lilly, Bariatric Advantage, Boehringer Ingelheim, Celebrate, CureX, and Hitachi. Thank you to all of our OCW 2021 champions as well. Make sure to check out our website and social media tomorrow, March 6th, for the closing of this important awareness week. Tomorrow is Eye Care Day, and we will be sharing all of the different reasons why we care about obesity. If you haven't submitted your video yet, visit obesitycareweek.org/icare and tell us why you care about obesity. Thank you so much for supporting OCW 2021. Goodbye.